Hi, my name is Alexis, and today I'm going to be discussing with you congenital heart diseases. As we know, congenital means present at birth. So, due to lack of closure or sometimes malformation of different areas of the heart, it can lead to these congenital heart diseases. The first one we're going to begin talking about today is the left to right shunt. This typically occurs because of problems in the atrial or interventricular valve, which means that oxygenated blood and deoxygenated blood are getting mixed together and or going the wrong way. When it comes to the atrial septal valve defect, what occurs is that there is a backflow from the left atrium into the right atrium and then into the right ventricle all the way back into the pulmonary artery. And this is a problem because the left atrium is carrying oxygenated blood. So now what is occurring is that there's a mixture of blood and is going back into the pulmonary artery. A defect in the ventricular septum can also lead to left to right shunt. In this case, because blood flows from a state of high pressure to low pressure and the pressure of the left ventricle is typically higher, the blood is backflowed into the pulmonary artery and left atrium because of the defective ventricular septum. This will cause the left side of the heart chambers to appear enlarged on a radiographic image. During fetal development, there is a vessel called the ductus arteriosus. It connects the pulmonary artery directly to the aorta. Because a fetus's blood does not need to be oxygenated, therefore, it does not require it to go into the lungs and then back up into the heart. So there's a constant flow of systemic circulation. Normally, the ductus arteriosus will close at birth or a few days later. In the event that this vessel fails to close, it will result in left to right shunt. This defect will cause oxygenated blood from the aorta to travel into the pulmonary artery and once again mixing oxygenated blood and deoxygenated blood. This occurs because since the aorta is at a place of higher pressure, it backflows into the left atrium and ventricle. This will have a radiographic appearance of an enlargement on the left side of the heart. Tetralogy of Fallot is another type of congenital heart disease. However, it consists of 4 different abnormalities in the heart that lead to this disease. These 4 abnormalities are high ventricular septal defect, pulmonary stenosis, overriding of the aortic orifice above the ventricular defect, and right ventricular hypertrophy. These abnormalities contribute to tetralogy of Fallot, which is the main cause of cyanotic congenital heart disease. The first abnormality we're going to discuss is the ventricular septal defect. The right and left ventricle are separated by an intraventricular septum. The presence of the septum is to prevent the blood from mixing from both chambers of the heart because they carry 2 different types of blood. However, when this interventricular septum is defective, it allows blood from both ventricles, oxygenated and deoxygenated blood, to mix. The secondary abnormality is pulmonary stenosis. This occurs when there is a narrowing of the pulmonary valve. The pulmonary valve is the passageway for deoxygenated blood from the right ventricle to travel through the pulmonary artery and into the lungs to receive oxygen. When there is a pulmonary stenosis, the heart has to work harder for the blood to be able to pass through the valve and into the lungs. This defect results in a deficiency of blood reaching the lungs. Another result of pulmonary stenosis is right ventricular hypertrophy. This occurs because the heart is working harder to pump blood through the narrowed valve and leads to increased muscle of the right ventricle. The aorta is the passageway for oxygenated blood to reach the rest of the body. It is located next to the ventricle where it receives the oxygenated blood. A person with an overriding aorta defect has their aorta located in between the right and left ventricle. This means that deoxygenated blood, rather than travel into the pulmonary artery, it travels directly to the aorta. Therefore, the aorta is pumping both oxygenated blood and deoxygenated blood into the systemic circulation, and that results in not enough blood reaching the lungs. All these abnormalities cause right to left shunting in the heart. This creates a problem for the lungs because not enough blood is reaching the lungs to be oxygenated, and that results in an increased degree of cyanosis. This defect, which is tetralogy of Fallot, will appear as an enlarged right ventricle, causing lateral displacement and upward lifting of the apex of the heart. The modality of choice for this disease is echocardiography to demonstrate the 4 abnormalities that result in tetralogy of Fallot. This condition is very rare, and it occurs in about 5 out of every 10,000 babies. The disease does not have a specific treatment. Depending on the severity of the defect, surgery only has a palliative and supportive role in the disease. Without surgery, most patients will usually die before reaching puberty. Another congenital heart disease that I will be discussing is coarctation of the aorta. As we all know, the aorta is the main vessel in our body that provides oxygenated blood to the rest of our body. Coarctation of the aorta means that there is a narrowing in the aorta. This occurs just beyond the branching of the blood vessels to the head and arms. In this case, the left ventricle will have to work harder in order for blood to pump through the narrowed aorta to the rest of the body. This defect typically leads to hypertension in children. This occurs because since the upper extremities have higher blood supply and higher pressure than the rest of the body lacks blood pressure. Patients will typically have normal blood pressure in the arms but low blood pressure in the legs. Another result of this defect is the progressive development of collateral circulation, wherein the tiny vessels in the body are enlarged to compensate for the lack of inadequate blood supplies. Modality used to view and diagnose this disease are echocardiography, Doppler echocardiography, aortography, and MRI. This condition can be surgically repaired. There are 3 different types of surgeries to correct this defect: end-to-end anastomosis, patch aortoplasty, and left subclavian flap aortoplasty, which means the surgical reformation of the aorta.